Good morning. It's December 16th, and this is your daily brief in science. Here's everything you need to know. A warming scenario of 4.0 degrees could push glacier loss to a peak between the mid-2000s and mid-2050s, with as many as around 4,000 glaciers disappearing each year at the peak. By 2100, roughly 18,000 glaciers would remain globally, with Central Europe holding about 20, a fraction of today's total. Every glacier matters for tourism, landscape, culture, and regional identity, and even small glaciers contribute to local water supplies and cultural heritage. Glacier extinction is a meaningful metric alongside mass and area loss, highlighting societal, cultural, and ecological stakes and the urgency of climate mitigation to preserve more glaciers. Staying closer to plus 1.5 degrees could nearly double glacier survivors by 2100 versus plus 2.7 degrees. Experts acknowledge study limitations, including uncertainties in counting small and debris-covered glaciers and data gaps, but maintain the findings show how climate decisions shape glacier futures. The study notes significant uncertainties in climate model projections and reiterates that actual loss rates depend on near-term policy choices and collective action. The projection uses the RGY version 6.0 framework with disappearance thresholds of area under 0.01 square kilometers or volume under 1% of initial, smoothing with a 5-year filter, and excluding regrowth in overshoot scenarios from surviving status. Pre-2025 glacier losses and potential undercounting of small glaciers are acknowledged, with data and code shared on Zenodo for transparency and reproducibility. The analysis covers more than 200,000 glaciers globally and introduces a framework to quantify glacier extinction timing with mid-century turning points driven by today's decisions. Adaptation ideas include new farming practices, alternative tourism livelihoods, and even artificial glaciers, as tested in places like Kyrgyzstan. Lander van Tricht of ETH Zurich emphasizes the need to know when and where individual glaciers disappear, underscoring predictive value for planning. Peak loss dates act as turning points for ecosystems, water resources, and cultural heritage with downstream communities, about 2 billion people relying on mountain water, urgently needing adaptation. Scientists modeled persistence by identifying glacial boundaries below 0.01 square kilometers or under 1% of their 2000 volume to mark disappearance. Moderna is expanding mNEXSpike into Europe as regulatory timelines and local market access permit, signaling ongoing growth in Europe's respiratory vaccine market. The European Medicines Agency (CHMP) issued a positive opinion recommending marketing authorization of mNEXSpike, mRNA 1283, for individuals 12 and older to prevent COVID-19. And Moderna has filed for approvals in additional markets while already holding U.S. Food and Drug Administration and Health Canada approvals. The press release includes forward-looking statements and standard risk disclosures and provides contact information for media and investors. In the Phase 3 study, a 10 microgram dose of mRNA 1283 was compared against a 50 microgram dose of mRNA 1273. Results showed a safety profile for mNEXSpike similar to Spikevax, with fewer local reactions and common solicited adverse events including injection site pain, fatigue, headache, and myalgia. Enrollment reached about 11,400 participants, with mRNA 1283 demonstrating a 9.3% higher relative vaccine efficacy overall versus mRNA 1273 starting 14 days after vaccination, and 13.5% higher efficacy among adults 65 and older. The press release reiterates Moderna's forward-looking statements on market opportunities, regulatory timelines, and global vaccine strategy, alongside standard risk disclosures, and notes ongoing endemic circulation of COVID-19 in Europe. Remarks from Moderna's chief executive officer touch on strategic focus as the company advances these regulatory efforts and market access plans. A new first-line option for HER2 positive metastatic breast cancer is now approved in the United States. ENHERTU, when given with pertuzumab, is approved for adults with unresectable or metastatic disease, marking the first new first-line option in more than a decade. The approval stems from the DESTINY-BREST-T09 trial, which showed a 44% reduction in the risk of disease progression or death with ENHERTU plus pertuzumab, compared with the standard taxane/trastuzumab/pertuzumab regimen, hazard ratio 0.56 and p less than 0.00001. At the time of analysis, overall survival data were not mature, with 16% of patients dead across both arms. The trial enrolled 1,157 patients across regions, stratified by prior treatment, hormone receptor status, and PIK3CA mutation status. Safety concerns include boxed warnings for interstitial lung disease or pneumonitis and embryo-fetal toxicity, with serious adverse events in about 27% of patients on the ENHERTU plus pertuzumab combination and 3.4% fatalities related to adverse reactions. Overall, the safety profile aligned with known risks of the individual drugs, with no new safety signals identified. The primary endpoint was progression-free survival, with secondary endpoints including overall survival, objective response rate, duration of response, pharmacokinetics, and safety. Final progression-free survival results for the monotherapy arm were pending. Efficacy data showed an objective response rate of 87% for ENHERTU plus pertuzumab versus 81% for standard THP therapy, with complete responses of 15% versus 8% respectively. The broader development program for ENHERTU covers multiple HER2 positive indications and emphasizes monitoring for ILD, neutropenia, and cardiac function as part of ongoing safety. Regulatory activity included RTOR and priority review under Project Orbis, with expedited reviews and international submissions coordinated across regions. The approval aligns with the ongoing ENHERTU development program and a global collaboration between DAI, ICHISANKYO, and ASTRAZENECAL, with companion regulatory activity in other regions. Anixa Biosciences has completed the transfer of the breast cancer vaccine IND from the Cleveland Clinic and now serves as the trial sponsor for all future development, marking a structural shift in its program. With full IND sponsorship, Anixa will lead the Phase 1 program and plans to move into Phase 2 trials across multiple sites, including the Cleveland Clinic. Market sentiment around the development is cautiously optimistic, with a target price around $10 and a generally positive buy signal reflected in a 2 rating. Financials show no revenue yet and a negative earnings per share of -0.3, but the balance sheet remains liquid with strong current and quick ratios and minimal debt. Regulatory and trial risks remain relevant, with a beta of 0.88 suggesting lower market volatility, but overall biotech risk and high stock volatility around developments. The announcement indicates no negative aspects from the Phase 1 results or the IND transfer, suggesting a favorable strategic fit for the company. Taken together, coverage frames Anixa as a speculative biotech with meaningful development upside but notable risk given clinical and regulatory hurdles. Ownership remains concentrated with about 16.7% institutional and 16.3% insider stakes, and there has been no insider selling in the past year. Final Phase 1 data were presented at the San Antonio Breast Cancer Symposium around mid-December, reinforcing encouraging safety and immune response signals. Valuation indicators show potential overvaluation relative to book value, PB around 7.1. While price to sales is not applicable due to lack of sales. Anixa continues to focus on oncology vaccines and therapeutics, including diagnostics and early treatment pathways for cancer. Enrollment in Phase 1 is complete with encouraging immune response and safety data, and the company intends to advance to Phase 2, conducting multi-center trials including the Cleveland Clinic. A runaway supermassive black hole has been identified by a 62 kiloparsec tail and a supersonic bow shock at the head of the wake, with these features serving as crucial evidence. The ejection mechanisms include 3 body interactions during galaxy mergers and gravitational wave recoil from a black hole merger, both natural outcomes as galaxies merge and their central black holes interact. The discovery underscores how SMBHs can traverse and reshape their host galaxies, and it points to ongoing efforts to locate additional fast-moving SMBHs. Announced in 2025, the finding confirms decades of theoretical predictions about rogue SMBHs and sets the stage for future systematic searches with Euclid and the Roman Space Telescope. JWST-NIRS-PEC-IFU spectroscopy, alongside HST data, enables simultaneous imaging and spectral analysis to determine motion, composition, temperature, and physical conditions, confirming the bow-shock and wake structure. The study, led by Peter Van Dolkum of Yale and published under the title JWST Confirmation of a Runaway Supermassive Black Hole via its Supersonic Bow Shock, analyzes the candidate SMBH and its surrounding gas using JWST-NIRS-PEC-IFU observations. In the cosmic owl galaxy system, about 8.8 billion light-years away, the first confirmed runaway SMBH, RBH1, is identified by a 62 kiloparsec linear feature and a bow shock at the wake's head. The cosmic owl consists of two active galactic nuclei forming ring structures, with kinematic data showing velocity gradients that support the bow shock interpretation at the wake tip. Earlier work suggested the linear feature was a wake behind a runaway SMBH. New JWST and HST data strengthen this interpretation by revealing the bow shock and confirming the wake as the SMBH's trail. The competition of data from JWST and HST strengthens the case that the observed features are a wake and bow shock produced by a traveling SMBH rather than alternative explanations. The implications include SMBHs escaping their hosts during mergers, gas compression, and potential star formation in the wake, and the expectation that more such objects will be found with future observations. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.